Hello, my name is Amber Morgan, and the title of my presentation today is Cholesterol-Lowering Medication Adherence, the Relationships of Depression, Medication Beliefs, and Illness Control Perceptions. High cholesterol is a major risk factor for the development of cardiovascular disease. Management of high cholesterol includes alternative lifestyle modifications, such as diet and exercise, and lipid-lowering medications. Lifestyle modification recommendations produce low rates of adherence, making medical treatment avenues imperative. Despite this, roughly half of patients never achieve overall adherence to their lipid-lowering medications. Medical non-adherence in general has been deemed a major public health issue that imposes a financial burden on the healthcare system and can have a major impact on patient health outcomes. Adherence is multifaceted and is associated with characteristics of the treatment, setting, and the patient. Due to the malleability of patient-related factors, they are often best suited as targets of interventions. Depression, illness perceptions, and medication beliefs have all been independently linked to adherence behaviors, supporting several health models, including Anderson's behavioral model and Leventhal's common sense model. However, to best understand the role of patient factors in adherence behaviors, the interactions between these variables should be assessed. As can be seen by the included hypotheses, this is what the current study aimed to do. The current study is based on a secondary analysis of a previously completed project, so the role of depression could be better understood. 36 participants who had been previously diagnosed with high cholesterol and treated with stable doses of statin medication for at least 3 months were recruited through a participating medical clinic. The participants were asked to complete paper questionnaires about their personal and medical history, demographics, coping strategies, perceived social support, adherence to medications, medication beliefs, illness perceptions, and stress and depression. The measures used in the current study were the Center for Epidemiologic Studies Short Depression Scale, the Revised Illness Perception Questionnaire, the Beliefs About Medications Questionnaire, and the Adherence to Refills and Medications Scale. As can be seen from the first figure in column 2, depression was correlated with concerns about medications, with higher depressive symptoms being associated with greater concerns about medication side effects. Depression was also correlated with refill adherence, with higher depressive symptoms being associated with worse refill adherence. Unexpectedly, depression was not shown to be associated with medication taking adherence. In addition, examining the figures in the third column, while not significant, the associations between medication concerns and both types of medication adherence do trend in the expected direction, with greater medication concerns being associated with worse adherence behaviors. Results of the current study indicate depression and medication beliefs do play an important role in medication adherence, and provides evidence that interventions that target these specific patient-related factors may effectively enhance medication adherence for individuals diagnosed with high cholesterol. In addition, depressive symptoms were found to be associated with concerns about medication side effects, indicating a possible relationship between the negative cognition found in depression and negative medication beliefs. This indicates a possible mediating role of medication beliefs on the relationship between depression and medication adherence. Future work using a larger sample would be needed to further examine the specific roles these factors play and the possibility of a mediating role of illness perceptions and medication beliefs. Specifically of interest is whether depressive symptoms produce a negative cognitive bias that influences medication beliefs and illness perceptions, and in turn, reduces adherence to medications. Thank you for listening to my presentation today.